Welcome everybody to Mole Rat Nation. I'm Bob Carmichael and let's get started. Testosterone, TRT, for longevity, Part 2, EPO. Erythropoietin, or EPO, is a hormone produced in the kidneys that stimulate bone marrow production of red blood cells. What raises EPO? When oxygen sensors called REPOS in the kidneys notice a drop in oxygen, additional EPO is released. What causes this effect besides testosterone? Holding your breath. Sleep apnea. Everybody that's on a CPAP machine right now has had a period of time where their EPO was higher than normal. People who live in high-altitude cities like Denver and Santa Fe, New Mexico, all have higher levels of EPO. These are all normal, and they reset our EPO set point. Doctors become concerned when hemoglobin rises above 17. The risk for strokes and heart attacks increase when our blood becomes this thick. But with 6 blood donations a year, risks actually decline. Surprisingly, EPO is good for you. EPO is a nootropic, or smart drug. In high amounts, it will keep your mind sharp, but EPO is a large molecule and has trouble getting past the blood-brain barrier. A peptide from EPO, ARA-290, is now in clinical trials to treat small fiber neuropathy. If you are a woman or a man that does not want to take testosterone, there are a variety of supplements that are advertised as being able to raise EPO. And if you have high hemoglobin and do not want to donate blood, there are supplements that can lower hemoglobin and hematocrit. Also, changing the way you take testosterone can reduce the amount of EPO that is released. Taking a daily cream or insulin needle injection of testosterone will cause a much lower EPO release than a weekly injection. Here's what I don't know. I don't know if raising EPO long-term will cause any kidney problems. Also, EPO raises angiogenesis. Would this affect existing cancers? I just don't know the answer to these 2 questions. In Part 3, we talk about iron management. It's hard to manage iron except by giving blood donation. In Part 4, we talk about estrogen management. Men do not make estrogen. They convert it from testosterone. And when their testosterone is very low, the balance between estrogen and testosterone gets way out of whack. We'll talk about what to do about that. In Part 5, we talk about sarcopenia. This is muscle wasting. If you've ever noticed old men at tennis courts or on the beach, you'll notice that they have very little muscle left. We'll talk about what to do about that and how to avoid it. In Part 6, we talk about depression. It's very common for men in their 60s and 70s to be grumpy and hard to get along with. Testosterone plays a big part in their mood. In Part 7, we'll talk about all the risks and side effects of testosterone. The end card you're about to see contains a playlist of all the different episodes of Testosterone for Longevity. If you click on it, it's much easier to find in your history file than it is to try to use YouTube search. Also, join the Mole Rat Nation. Click on the Mole Rat and become a subscriber to this site. Thanks for watching.